Good afternoon. I'm Dr. Yvens Laborde from Ochsner. I'm the Medical Director for Global Health and Public Health at Ochsner. And as you know, I've been partnering with l'Hôpital Justinien, the Ministry of North, and also Fondylsahh for many long years, working very closely with Dr. Dube and also with Dr. Okap as well. And so I'm here today because they've been facing a lot of challenges. As you know, Haiti's been going through a difficult time. Recently, we've been unfortunately impacted by some severe natural disasters, recent flooding in Léogane. We also had an earthquake in Jérémie, along with the ongoing political instability and as well as significant issues with economic resources and also human resources, problems with having access to medicine. And so all of these things have come together to really create almost a crisis of the healthcare system. And so based on our long-term relationship and partnership with l'Hôpital Justinien, with Dr. Okap and Dr. Dube, we invited ourselves to have a discussion to talk about ways that we can make sure that we continue our collaboration to improve the situation going forward here. As you know, cholera has taken a resurgence. Unfortunately, Dr. Dube, as the director, had made sure that we had an infrastructure in place to respond to the emergency. And so they've been having almost 20 patients a day, primarily pediatric patients, that if it wasn't for his foresight and his preparation, we wouldn't have the infrastructure to care for those patients. And so fortunately, in spite of all the challenges and difficulties in human resources and medications and staffing and lack of access to sometimes air conditioning, water, medicines, he's mobilized everything he can to make sure that those patients are taken care of. So I just wanted to, number one, thank him for his ongoing partnership and commitment to taking care of the community, to taking care of the facility, and also for his leadership under some very difficult circumstances. And so, Dr. Dube, how are things going?
I'm fine.
No, I know you're not fine, because I know you're having a lot of challenges. What do you think is probably the most important thing that you're dealing with now?
I can talk to the Creole?
Creole, English, n'importe.
Okay. Et bon, merci Dr Laborde, et nous connaissons que Justine nous porte le cœur.
So he says, thank you, Dr. Laborde. I know that you carry the community and Justinien in your heart.
Et nous avons effectivement à chaque moment que nous fait face à des problèmes et ponctuels, ou toujours, et chaque fois nous parlons avec vous, nous expliquons comme si tout problème qui a gagné, donc ou toujours faut être sûr ou garder nous pour qu'ils soient capables de faire de façon ponctuelle. Merci pour toute disponibilité avec tout les autres qui ont supporté. On va quand même faire petit à petit et nous avancer à certains problèmes que l'hôpital a confrontés.
So he says, first of all, he'd like to acknowledge the work that we've been doing and the support that we've been providing and working closely with him in collaboration to assist the hospital in whatever way that we can in terms of when they face a crisis or emergency. For example, they had the fire back in 22 when we were present. And even now, with the situation with the cholera, we always make sure that we're there to partner and collaborate, through Fondylsahh, through obviously Ochsner, which is there to support me, and being here to help address some of those issues.
Nous citer par exemple, nous capables de faire des preuves, donc nous sommes là avec nous sur Covid et au niveau de participation en plus de notre partenaire, mais vraiment au niveau de participation et qui a ajouté à support ministère, à support de notre partenaire, ou qui est là encore et dans des activités récemment, nous connaissons que par le biais d'autres efforts que le support en entrant qui était quand même aidé, en plus de tous d'autres partenaires qui avaient aidé, mais quand même, chaque fois on peut au grain de sucre dans un bloc en construction, c'est que bon avancé qui fait, ou encore là, même dans le grève, dans le travail et qui gagne comme des lancers maternité, on fait un petit appel à eux-mêmes pour te supporter pour 2 infirmières et pendant 2 mois. Donc, et sans réfléchir, il est très tard de parler de ça et vous pouvez encore répondre de façon automatique. Donc, merci avec toute attention ça.
Thank you, Dr. Dube. You know, he says, you know, obviously we've been good partners when they've had issues that have arrived. We've always been able to try, based on the partnership, because it is a partnership, to respond. So, for example, we were gone with a lot of other partners as well. We were instrumental in helping them overcome some of the challenges with the COVID pandemic as well. And recently, during the strike, obviously, they've had some issues, and we're working to try to provide some support, to provide resources, to provide staffing specifically for the maternity. We've also continued to provide some support along with the other partners to the cholera center to help manage the cholera patients. But I know he's saying thank you to us, but I think Fondylsahh, me personally and professionally, you know, Ochsner as well, as well as the ministry and even the GOH, we want to say thank you to you. We want to express our appreciation to you, to Dr. Cork, to Dr. Chuen, because we know how difficult it is to manage these situations, and I know your commitment to making sure that you do everything that you can to take care of your staff, to take care of the residents, but most of all, to take care of the community. So, as your partner, you know, Fondylsahh, which is always first and foremost, and who is the official linchpin. You know, there is nothing else without Fondylsahh, because it's based on the relationship that Fondylsahh has. It's able to bring the support that it actually has. And so we want to say thanks to you, and we want to do all that we can to continue to support you and encourage others as well to support us so that we can support you and continue the work that you've been doing, because there's an academic, this all started because we're academics. We love to teach, we love to take care of individuals, and we want to make sure that the academic mission is always first and foremost, so we can, number one, care for patients, number two, teach and train our residents so that we can have a healthy and completely well community, because you always say, la santé est la richesse. And so health is wealth. And so we want to make sure that we provide health so that the people can be well. So thank you, Dr. Dube, for your partnership, for your cooperation, and for your ongoing efforts.
Bon, merci aussi, Dr. Laborde, au point de vue Dr. Cork, Dr. Jasmin, Dr. Turel, donc on est toujours compté sur vous et que nous pensons que c'est un partenaire qui va aller au-delà de nous-mêmes, parce que quand même, il y a des gens qui peuvent remplacer nous, oui. Et peut-être au-delà aussi de nous-mêmes, puisqu'il y a des gens qui probablement ça va comparer nous, tel que Justine avec Fondylsahh, il fait de longue vie. Merci.
Okay.